80% of orthopedics is non-surgical. And I think that this is a field of medicine that historically never had a non-surgical counterpart. So what we want to do is we want to fill that gap between physical therapy and surgery. And there's a large gap in there that we can really help out a lot and get people better without having them go under the knife. I always grew up knowing that I wanted to be a physician. So I spent 4 years in the Navy, practicing as a general medical physician, thinking at that time that I wanted to go into orthopedic surgery. So after I did my 4 years in the Navy, I decided to look at other options, and that's when I found primary care sports medicine. And I also had the chance to work with professional teams. I got to work in the training room with Washington Redskins. I got to go to the Nats spring training down in Florida. And I also got to work with DC United throughout the year. At the end of my fellowship, I had to make a decision if I wanted to go into private practice or if I wanted to go into an academic position. And so 2014 in March, ROSM was born with 3 founders, me, myself, David Wang, and Victor Ibrahim.
When I talk to my patients, I'll tell them, all right, let's forget everything we know about medicine. Like, forget all about the technology, forget about surgery, forget about MRIs. Let's take it back to the days of like cave people, all right? If you had an option of how to best take care of an injury, what would that be? Well, it would be to enhance your own ability to heal. You don't want to, throw medications in there if you can help it. You don't want to cut things open and put in artificial parts if you can help it. Instead, you want to enhance what your body can already do in terms of healing. And that's what we endeavor to do here in our practice, is to provide treatments that will jumpstart your body's own healing process. We have a wide range of folks that come to see us. We have some pediatric patients as young as 8 or 9 years old, all the way up to folks in their upper 90s and everybody in between. We have folks that are not very physically active, all the way to our elite and professional athletes.
I had tore my labrum, tore hamstring in an accident, a biking accident. And look, I needed to get back on track. I had a couple injections. I went from not even be able to raise my leg because of the hip labrum and the tear on the hamstring, to now I obviously have full range of motion. I'm a runner, run about 60 miles at the least a week. And look, I'm already back now. I'm doing my 50 or 60 miles. I'm doing my marathons and everything again. Dr. Farrell understands all of this stuff because with his sports background, and that is just so much bigger than me than going to see the regular person.
We really want to find out what they want to do, what's important for them, and figure out the best path for them to get there. Really working very closely with physical therapists, personal trainers, chiropractors, nutritionists, dietitians, rheumatologists, neurologists, all this degree of the medical field. All these treatments can be used in coordination or on their own to help the patient achieve their goals. And the main goal is to help them getting back to whatever they need to do.
And you see a lot of people in a lot of different difficult situations, and you have an opportunity to really learn from them and help them.
He really listened very, very carefully and really was very thoughtful about what's going to work for me. And I couldn't have a knee replacement because of the neurological illness I'd had. So nobody was going to do a knee replacement. And here I was stuck with not enough cartilage. And instead of a knee replacement, which is a very serious surgery, major surgery, and long recovery, I got one shot. And that built in the cartilage in my knee that I'm walking for the first time in 10 years. So that's a very big deal.
One of the main things that sets us apart from all the other practices is every single one of our physicians teaches either musculoskeletal ultrasound or regenerative medicine on a national basis at conferences or at universities and medical schools. And so when you come to ROSM, you're getting expert care from people who write the textbook and aren't just trying to pick up a new tool for their toolbox.